Good morning, afternoon, and evening to you in the YouTube universe. My name is April Lynn Grubb. I'm a senior level nursing student at Indiana State University participating in community health nursing. And today I'd like to discuss childhood asthma with you. I did include attached to this video both a handout and a pre-test that is also a post-test. If you would please go ahead and take that pre-test. We'd like to make sure that you get all of the information you need out of this presentation, and then we'll take the test again at the end. My learning objectives for today is I would like to talk all about childhood asthma. I would like to talk about risk factors, common triggers, symptoms, treatments, medical care and our expected course for childhood asthma, and accurate resources for asthma questions and answers. So what is asthma? Why do children get it? Asthma is a chronic long-term illness involving the lungs. It might only happen once a year, 6 times a year, or every day. It could cause problems the same as an adult, but children have small airways, and we also know that children have a difficult time communicating, especially infants. That can lead to certain challenges with medical treatments. We'll go ahead and take a look at our risk factors and triggers. Well, what is a risk factor to develop asthma? We know in the medical community that if a child has parents with asthma or a strong family history of asthma, let's say they have 7 cousins and all of those cousins have asthma, we do know that those children are more likely to develop asthma. If a child has allergies such as food or skin allergies, we know that there's a perfect trifecta of asthma, allergies, and atopic dermatitis, which is a skin allergy. We know that children who are obese are at higher risk of developing asthma. We know that children who are exposed to tobacco smoke, either in the womb before birth or inside the home or caregiver's house, are at increased risk. And then there are certain children that having certain illnesses at a very, very young age can lead to asthma. We know that there are triggers for asthma symptoms. We know that exposure to smoke is definitely a trigger. We know that being around animals, most commonly cats or dogs, but sometimes other animals as well, can trigger. Rapid weather fluctuations, like we see here in Indiana, where it can be spring, winter, summer, and fall all in one week. Those types of fluctuations can really send asthmatic children for a loop. On the same vein, very cold or very hot, humid weather. So very cold, under 15 degrees, sometimes under 20 degrees. Once you get into those negative digits or above 90 in those hot, humid weather like we do get here in Indiana sometimes, that can trigger asthma symptoms as well. Viral or bacterial illnesses, ear infections, and there are some kids that vigorous exercise is the only time they have asthmatic symptoms. That's called exercise-induced asthma. But what actually causes it? And unfortunately, we don't know. There's lots of risk factors and triggers, but we certainly still don't know the reason that asthma develops in some people and not in others, and certainly in some children and not in others. What are some symptoms of childhood asthma? We might only have just a little nighttime cough or chronic cough that may be the only symptom we've got. Your child may be completely fine and they might cough for half an hour at bedtime. That can look like reflux to most people with babies. We might treat the reflux and the cough stays and we just can't figure out why. A lot of times it could be asthma. Other symptoms include changes in their breathing, the way their nose looks or their belly looks when they're breathing, persistent coughing, especially at night, tiredness. We might see skin color changes on the lips, around the eyes, and the fingertips. We might see some feeding problems in babies when they nurse or drink bottles. And we might see sleeping problems due to lung symptoms. If you're up coughing all night, you don't really get good sleep. When should I talk with the doctor? Well, I should talk with a primary care doctor anytime I have concern that my child might have a chronic illness. But if you happen to notice your child has constant coughing, especially during a certain time of year, or is a cough that's waking them at night frequently and they're not otherwise ill, you definitely want to talk to your doctor. If you hear wheezing sounds or your child seems short of breath, if your child has been one of those kiddos that has had bronchitis, pneumonia, or croup 8 million ways to Sunday, you might want to talk with your primary care doctor about the potential for asthma. When should you see an emergency room doctor? It is possible that your first instance of asthma could be a really bad one. And so if your verbal child has to stop mid-sentence to catch her breath, we can't get more than 3 or 4 words out without taking a breath. If they're using their stomach muscles or their nose is flaring in and out, if your child is making grunting or sighing noises during breathing, or if we have those nostrils flaring in and out, you have to get to an emergency room doctor, no questions asked. On this screen, I'm showing a few common treatments. So on the right, we see a little girl who is using an inhaler with a chamber device. Now there's options. You see that little girl has a mask. We do have the mask option because we use inhalers for babies that are even a year old, for those that we can't get what we need with the nebulizer. So those inhalers with chambers are great, and you have a mask option or a mouthpiece option. If your child is using an inhaler, they should always use it with a chamber. If you as an adult is using an inhaler, you should always use it with a chamber. Otherwise, you're simply throwing away money and the medication's not getting to where it needs to go. Down lower on the right is a nebulizer. A nebulizer is a slower, longer treatment, but we do find in pediatrics that some kiddos seem to respond better to nebulizer treatments, especially when they're really sick. So the nebulizer also has a mask option, just like we see with the inhaler up top, and can be used for any age of child, all the way up to a 99-100-year-old person. As far as the medications, there's typically 3 different kinds. There's a long-acting one. Those long-acting ones, the whole point is to reduce swelling over time. I've listed some common names there for you. Those we take every day, each and every day without fail. Those short-acting medications are only to be used in an emergency. They treat the symptoms, but they don't treat the inflammation. I also included some common names there. The last category is the leukotriene inhibitors and allergy medications. We know that kids with allergies, we give them allergy medicine and control their allergies, and their asthma might improve. The same with Singulair, which is a leukotriene inhibitor, seems to somewhat supercharge those medications and work better with allergy and asthma medications. Complications from asthma, we have immediate risks of asthma attacks or pneumonia, a very severe asthma attack called status asthmaticus that does lead to death in children. And then long-term, we do see permanent lung damage, poor school performance, and chronic fatigue. What can I do for my asthmatic child? Number 1, give their medications every day without fail, even if there's no symptoms. Easiest to combine this with another everyday task like brushing teeth or dinner. Use your short-acting rescue medications, take your allergy medications, and get help if they aren't working. Also need to avoid triggers. Get that smoke out of the home. Don't take them to places with cigarette smoke. Don't take them to places with cats or dogs if your child is allergic to them. Encourage physical activity when they're healthy, and then make sure you attend routine follow-ups with your doctor. Biggest myth, won't my child outgrow this? It's actually a myth. Children do not outgrow asthma. Their symptoms simply change. Asthma cannot be cured yet, although we sure hope there will be. Lifelong treatment is important to prevent lung damage. Here's information on how you can learn more, talk to your doctor, a lung specialist or an allergy specialist, and some reputable websites that you can use to determine if you have other questions. Those are the best places to go for research. I've also included a slide of references that I used in preparation for this presentation. I encourage you to reach out to your medical provider if you have questions. And at this time, I would really appreciate it if you would once again take that pre-test now as a post-test and see how you did. Thanks so much for watching.